Okay, here we have Sadie, and about 2 months ago in a week, she came in for a consultation. She's a professional dancer, and the problem is she has some scoliosis, so that's causing undue muscle contraction, uneven on both sides, especially the upper shoulder blades and low back. So I want you to describe what was your back like before starting the laser stem cell therapy, and what is it like now 2 months later? Kind of like what you described earlier.
Uh-huh. I would say prior to starting and just consistently when I was in school dancing 10, 12 hours a day, crazy things, I just felt like I would be able to get through the day. I could manage, get on with it, but I just feel like I was always consistently in like a lot of pain, kind of bearing with it. Dance is like what saved my back, but at the same time, people with scoliosis as severe as mine aren't meant to be doing the things I'm doing. So I was putting my body through the ringer a good amount. And then not dancing as much now, this was kind of like the perfect time for me to take advantage of that and kind of heal, cure, whatever, treat my spine. And as a few things have been opening up, I've been getting into some ballet classes, which is very technical. And since doing these treatments, I feel like I have very little issue, if none, with mobility, which has been great because I feel like some days it catches, or it would catch like in the past, but for the most part, I feel like I haven't had too much like muscle tension that's been stopping my mobility. I feel like honestly I feel more flexible. I just think doing this combined with like finally taking care of myself and healing and taking the time has been super important to my dance career. I feel like this is like the good little boost I needed.
And you mentioned you weren't able to sit your traps on your lap.
Right. As far as like the tracking of like muscularly for exercising, I do Pilates as well a lot, and I feel like I wasn't ever able to like work very evenly. Even in dance class, like it's called port de bras, the way I hold like my arms, I always felt like one shoulder was like hiking up a little bit, so I had a hard time like kind of forcing it down, but by forcing it down, that causes the tension. So with the treatment in my shoulder, I feel like I've been able to kind of like release that and just like let it sit like naturally on my back. So like now like working in Pilates, I feel like I can finally like fire up my lats, get some strength in my back, so that and hand in hand with the scoliosis. So it's like a nice balance starting to happen. Get a little bit more strength.
2 months later, how many percent improvement? I know it's subjective. Did you report so far?
I reported 50, which is definitely subjective. Yeah, I always like to work qualitatively.
Well, I'll take it. Usually,
yeah.
in your case, we were thinking maybe 5 months or 6 months, you'd be 50% better. Here we are 2 months later, so definitely. Yeah. So today definitely. We're going to do a little more muscle work with the myofascial release tools, get you on the back end track for the scoliosis, and do some laser and shockwave just to keep the cells stimulated, okay? Congratulations, and we'll schedule your next follow-up at month 6, which is in 3 months, okay?
Cool.
All right, just go out and I will text Noah your treatment instructions. We'll go from there, okay?
Awesome. Thank you.
Right, we'll see you.